As a preliminary matter, this is Stephen Vigent, Chair. Please permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. Jenny Fishman, I guess she's not here yet. Dr. George Abraham.
Okay.
Staff, when I call your name, please respond in the affirmative. Carrie Stockwell.
Affirmative.
Good morning. This open meeting of the Board of Health is being conducted remotely, consistent with Governor Baker's executive order of March 12, 2020, due to the current state of emergency in the Commonwealth due to the outbreak of the COVID-19 virus. The order allows public bodies to meet entirely remotely, so long as reasonable public access is afforded so that the public can follow along with the deliberations of this meeting. For this meeting, the Board of Health is convening by Google Meet, as posted on the town's website, identifying how the public may join. Please be sure to press *6 to mute your device. This meeting will not feature public comment. Finally, each vote taken in this meeting will be conducted by roll call vote. So this meeting of the Board of Health is being held on Friday, March 19th, 2021 at 8 a.m. pursuant to Governor Baker's March 12th, 2020 order suspending certain provisions of the Open Meeting Law, General Law, Chapter 20A, Section 18, and the Governor's March 15th, 2020 order imposing strict limitations on the number of people that may gather in one place. This meeting of the Board of Health will be conducted via remote participation to the greatest extent possible. To participate in the meeting, please dial 1-617-675-444 and enter the following PIN number, 344-747-421-5447#. Please mute your device until the chair of the board addresses the agenda item or opens the meeting to public comment. This meeting is now called to order. The first item on the agenda is to review and approve the minutes from the February 26th, 2021 Board of Health meeting. Do I have a motion to approve?
I motion.
So moved.
Is that you, Jenny?
Yes.
Okay. All in favor signify by saying aye. Dr. Abraham?
Aye.
Jenny Fishman?
Aye.
Steve Vigent, aye. So the meeting minutes are approved. The next item is to review and act on establishing an effective date for the Shrewsbury's rules and regulations for body art establishments and body art practitioners that passed at the February 26, 2021 Board of Health meeting. And obviously, we just need to agree on an effective date for these revised regulations. Carrie, is any reason why we can't use April 1st as the effective date, or is that too soon?
No, I think April 1st would be fine unless the board wants to, is more comfortable with May 1st. That's fine. Whatever you decide.
So the practitioners are aware of these regulations then, so it's nothing new to them.
Correct.
Okay, does the board agree to a April 1st, 2021 effective date?
Agreed, Mr. Chair.
I second.
Okay, therefore, we will use the effective date as April 1st, 2021 for the revised rules and regulations for body art establishments and body art practitioners. Okay, the next item on the agenda is to review and act on tools to assist communities with addressing racism, previously presented by Sarah Ting of the World Unity, Inc. at the February 26, 2021 Board of Health meeting. And this item is on the agenda because following Sarah's presentation, the board received an email with various messaging that Sarah was proposing that the town take part in. Is the board in favor of using any of this messaging?
Mr. Chair, yes. I'd be happy to be supportive of the messaging as well as the materials. I didn't find anything in that which was controversial, and I would recommend that we move it to the town meetings that they can approve it, especially in the light of the recent events of the last couple of days in Georgia. This is all the more prescient.
I agree.
I agree with you, Dr. Abraham and Jenny. I think it's something that's well worthwhile. So the Board of Health is agreeable to this. I guess from this point, the town manager's office and selectmen will need to weigh in on this, Kerry?
Yes, that's correct.
Okay, so that will be the next step. So the Board of Health is in agreement that this is a good thing to do. Okay, the next item on the agenda is to review and discuss coronavirus COVID-19 update. And Karen, you're on the phone, right?
Yep, I'm here.
Is Karen Clark on the phone? Oh, she is. Okay.
Yep. Can you hear me?
Yes.
Hello?
Yes.
Oh, okay.
Yes,
Sorry. I wasn't sure if you
can.
could hear me.
Hello.
Yeah.
Okay, great. Good morning, everybody. Happy Friday. So I'll give you some updates, and obviously if you have any questions, let me know. So we're still, seeing some level of positivity here in Shrewsbury and the Alliance. We're definitely not out of the woods, and Dr. Hirsch, our medical director, continues to sort of remind the public that we need to stay vigilant. We're kind of seeing, people are tired of wearing masks and not sort of getting back to what things were like pre-pandemic. But even with vaccines happening, which is very hopeful and an exciting thing to be able to do, we still got to make sure that we're masking up. Certainly, Dr. Abraham can speak to some of the variants that are out there that we know are here in Worcester County, the UK variant. I believe there's the Brazil variant that's also was found in the Boston area. So we have a lot of things that we still need to be concerned about, even while we vaccinate. So it's critical that we're vaccinating as many people as possible so that we can get the vaccine into arms while these variants are floating around. So as far as the update on vaccinating for Shrewsbury, so as you know, we were asked by Mass DPH to set up a regional emergency dispensing site in the beginning of January, which we did for first responders. We continue to do between 300 and 500 vaccinations a day for the different phases that opened up for Worcester and our Alliance communities. As you also know, there's been at times what feels like even hourly changes are certainly sometimes daily changes to what the state is asking local public health to do in terms of, shifting whatever the planning was for EDS, which is something that we planned for years, to now sort of taking vaccine allocations and putting them more towards mass vac sites and also regional sites. So the Worcester Senior Center location is going to be standing down, and our last second dose clinic is going to be on March 30th. That being said, City Manager Augustus and Kevin Izakar and others have really expressed concern about, trying to continue to vaccinate the different phases that are in the Alliance, including seniors who are still having a difficult time getting appointments and others. But also because we all want to see our kids go back to school, trying to figure out a way to do some special vaccination clinics for K through 12. So the city manager was able to successfully negotiate with the state to have the Worcester State University site, which is a regional location, it's not a mass vac site, to offer 4 special teacher days and staff for K through 12. So we hope to get those links today so that we can send those to the towns and also in the city to get these folks registered to get a vaccine. So it's not 4 consecutive days. I think it's 4 days that occur over some weekends. But we hope to be able to vaccinate up to 6,500 individuals through that special arrangement. We also know in terms of access points, as vaccine continues to become available, we're hearing that the CVSs of the world continue to get vaccines. We're also hearing about some grocery stores that have it, as well as primary care docs will be getting it. And then hopefully we can continue to, have more access points for people to be able to get it as the phases continue to open up. So I'll stop there, just see if anybody has any questions.
Any questions from the board?
I have none.
Go ahead, Jenny.
No, I was just saying I don't have any questions. Thank you.
Oh, okay. Dr. Abraham?
And I was just going to mention to Karen's point about the 4 K-12 dates are March 27th, April 3rd, April 10, and April 11th.
No, thank you, Dr. Abraham.
You bet. So those are designated as K-12 days. So just a shout out to Karen and her team for an outstanding job with the Worcester Senior Center site, and that's now being consolidated the Worcester State University, which seems to be going relatively smoothly, hopefully. So we should be able to hit our original plan target of 1,000 doses a day, and then 2,000 with returning vaccine for second dosers. So that seems to be going well so far. We have heard some uniform compliments about it. And to address Karen's point about variants, there are variants. So from our own institution, we've sent a specimen of somebody who just returned from Brazil to the state for sequencing for potentially Brazilian variants. So it is an increasing concern of the different variants, but specifically the UK variant is now pretty much the predominant variant in the state and in the area, which is completely responsive to the vaccine. So we have no concerns from that standpoint. The concern would be if the South African variant takes hold, which hasn't as yet.
Okay, very good. Thank you very much, Karen. Appreciate you coming on today.
Sure, thanks for having me. And I just wanted to say, Dr. Abraham, St. Bees and the whole team has been so supportive and really, really easy to work with throughout this whole process. So I just want to thank you and Carolyn Jackson and your outstanding team for working with the city, letting us borrow vaccine when our supply doesn't come in on time, and just always being a great partner. So thank you so much.
You bet. It's a true feeling of partnership. So thank you.
Okay, very good. So the next item on the agenda is to review and act on the report from the Central Massachusetts Regional Public Health Alliance.
Good morning. So for
Good morning.
Oh,
Yes. Okay. We had 41 total inspections for this past period. We did have to shut down the Moe's for about 10 days because of a roof leak and some electrical issues, but they are now reopened. We have one new business open, the Cafe Noir, and one new mobile cart. We're also getting ready for pool season and farmers markets, things like that. And COVID complaints have continued to decrease, which is a good thing. And we're just trying to keep up to speed with all the rule changes and phase changes and help everyone else figure it out as we go along.
Okay, any questions from the board for Micah?
None, Mr. Chair.
None for me.
Okay, Karen Clark, did you want to say something or?
No, I apologize. I was speaking to someone and didn't realize I wasn't on speaker. I was still on off mute. I haven't mastered the mute button, and my apologies. No, that was just a random. Oh, continue. My apologies.
So it's a never mind. Okay, in that case, then the next item is to review our meeting schedule. And in doing that, I just wanted to point the board towards the email that we got from Cherry Tangri from the Alliance, providing us with information on changes to sample tobacco regulations. And I just wanted to find out if the board is interested in having Cherry come speak to a meeting in the near future.
Sure.
Yeah, that'd be great.
Okay. So, possibly the next meeting, if that works out for Cherry.
Yes, that would be good.
Okay. So in terms of the next meeting, I have a conflict with April 23rd, so I can't do that.
Okay, April 16th.
Carrie's not available on the 16th. How's the 30th looking?
I can do the 30th.
Okay, mine might be tentative. I'm taking over as president of the American College of Physicians, and that weekend is our meetings where we take over. So that it's those the national and international meetings actually. So not 100% sure as the time works out. But let's tentatively pencil in for the 30th. If I have a contact, I'll let you know, Mr. Chair.
Oh, that would be fine, Dr. Abraham, and congratulations on that appointment.
Thank you.
Indeed.
Woohoo!
Okay, so we'll have a tentative
Shrewsbury's
next
on the
meeting.
national map. Let me put that. Sorry, I was just saying, was being semi-facetious, but Shrewsbury's on the national map because everybody's asking where's Shrewsbury now. That's the address officially linked to my name. So.
Well, that definitely puts us on the map, Dr. Abraham. Thank you. So we'll have, our next tentative meeting then will be for April 30th, 2021. So in that case, do I have a motion to adjourn?
So moved.
A second.
Okay, all in favor signify by saying aye, Dr. Abraham.
Aye.
Jenny Fishman.
Aye.
Steve Vigent, aye. So this meeting is now adjourned. Thank you, everybody, for coming on today.
Yes,
Thanks
thank
so
you.
much.
Have a
Have a
great
good day.
weekend.
Thank you. Sorry I was a little bit late.
Thank you.
Bye-bye.
No problem.